Well, good morning, everybody. It's Daybreak here at iFiber One News Radio, continuing on with great conversations here on Hospital Week. And we're all leading up to Saturday's free community health event from 9 to 1 at Mason General Hospital in Shelton. We've been talking a lot about some of the great things that people will be able to see and do and learn more of. One of the other portions of healthcare is navigating through insurance plans and finding out ways to pay for those. And I have Enrollment Liaison Susana Lopez in studio with me this morning. Good morning.
Good morning.
Thanks for coming on.
Thanks for having me here.
A very important portion of healthcare is the insurance and then the funding sources for that. So give me a little bit of a background on what you do at the hospital.
So what I do is I help people with the application process. I help them navigate the health plan finder to look at what options are out there, look through the plans, and kind of basically educate them so that they're able to make an educated decision when it comes down to making choices for healthcare. Some
of the things that maybe past histories that could lead to potential things when you go through the checklists on the different bronze and gold plans, you see different benefits to both of those things, and that's what you talk about. You say, well, this one may be a little more suited to your types of needs and things like that. Yeah, so I basically, ask my client what are their needs, what is important that they have in their insurance, and so we, based on what their answers are, we kind of filter through the plans and see what's out there for them. Are there a lot of folks in Mason County who perhaps are eligible for subsidized plans and things like that? Yeah, there's a lot of people who are, and sometimes they don't know it until they come see me. And sometimes people think, oh, no, I make too much. Well, you don't know until you come, and when you come see me, you're under no commitment to buy anything. It can be just to browse. I'm basically there to answer any questions you have or guide you through doing the application. And is that one of the things that we'll be able to do this weekend? You'll have the information in there, and folks will come on up to you, and then you kind of plug it in and go through it? Well, I'm going to be handing out, flyers, setting up appointments. But if somebody comes that needs insurance right there and then, I can certainly accommodate that. But my plan is to, educate people, give out flyers, and set up appointments for What are some of the things when someone makes an appointment, they want to come in and start going through this process? What do you need to bring with you? So your ID, social security number, income, like pay stubs if you have any, your immigration status. So if you have a green card or a visa, bring those. Those are important materials to bring. And basically that's it if you want to do the application. But if you're just coming to ask questions, you don't need anything. What are some of the common questions or concerns that people, either you hear in the community about the availability to find plans, pay for plans, or things like that? Are there some commonalities between folks when you hear from them? I just hear a lot of people say, "Well, I can't afford it." It just everything when I go in there looks so expensive, but a lot of the time they're not doing the whole application, so they're not entering like their income and all that to see if they qualify for any subsidies. So that's just what I hear. It's too expensive. Too expensive. And yeah, I guess so. If you're going through the process and you just see the base number for this gold plan without filling in any of your information, those numbers could be quite significantly less depending on your income. Correct. And and there's a lot of other questions about like tax, who you're claiming, and if you are claiming some people, that helps you too with your tax credit, even though it may be somebody that's not living in your household, but you are claiming them. Sometimes people forget about that stuff until the question comes up. This weekend at the All Health Free Community Health event from 9 to 1 is at Mason General Hospital, and Susana Lopez will have information on how you can get enrolled in healthcare and health insurance. And again, this helps folks avoid going to emergency rooms, and then that cost gets translated to all taxpayers. Isn't that right? Yeah, so, the hospital does offer charity care, to help with that kind of stuff. But why not come see me? I can maybe help you get some kind of insurance, and that way you can continue your health care, Sometimes people don't go to the doctor because they don't have health insurance, so they'll just go to the emergency room when it's, really bad. Yeah. So why not come see me and maybe we can do something. And it is a lot of preventative maintenance availabilities
Yes.
too in these plans too.
Yep, because they all have preventative care. It's free once you're paying for the plan. They have the free preventative care, so help you take care of your health and avoid those bigger issues.
Lots of questions, a complicated process, but that's why we got great folks like Susana Lopez to help navigate through these. Enrollment Liaison for the hospital here, and talking about this upcoming weekend's free community health event where there'll be a lot of information on plans that perhaps you can qualify for. You may not have even known that you're going to have those qualification statuses. Susana, thanks for coming in today.
Well, thank you for having me come.